Welcome to United RX's presentation on the proper discharge protocols and framework links capabilities for discharges and control medication destruction. Filma Yusan, our head nurse consultant, will be reviewing the first part of the presentation, and then I will jump in and show the framework links aspect of it. So without further ado, I will turn the call over to Filma.
Hi, good morning. I'm Filma Yusan, nurse consultant from United RX Pharmacy. First of all, we're going to discuss discharging residents to home. You should have an order from your doctor to discharge the resident. Inquire whether or not you're going to send the medications. If they have controlled medications, include those too, and then make sure to write orders in your PCC. Now, secondly, we have to complete facility discharge instruction form. You might use your own form, or you can use the form that pharmacy has in framework link, and that will be discussed by Andrew later on. In your discharge instruction, this will include your list of medications. This process can be done also in framework link. It's in there. If you're writing orders list of all these medications, I would suggest to write it in layman's terms, not utilizing medical terms, just like as BID, TID, QID. Families or residents might not know what you're talking about. So make sure to please indicate entirely if it's daily, BID, it's twice a day, 3 times a day, or 4 times a day. Make sure to include directions for using all those medications. And then have resident or resident's representative to sign the post-discharge form. If you're sending narcotics, make sure they're accepting responsibility of the resident and 2 nurses to count these medications and have them sign that they receive the number of medications that you're sending. That's for your narcotics. But the rest of medications, it can be given to the family and signed by the representative or the resident. Now, once these are done, original form should go to the resident or the family, and then the copy of the form should be in your healthcare record. Now, your narcotics, the signed one should be on your side only. Don't send it with them. In your policy and procedure, it says there that you have to have a copy for your DON. So make sure to check on your policy and procedure. So you should have 3 copies all in all that has the signed record. So emergency transfer. We have to obtain doctor's order to transfer resident to the hospital. Then you have to call the ambulance to transfer, and then you have to inform the resident on what's going on, why the resident is being transferred to the hospital, and also the POA, your power of attorney, whoever or family, whoever takes care of this resident, inform them. But if it's really emergency and there's no time, that's fine. You can send the resident to the hospital, but make sure call the family right away, okay? Next is medication management after transfer. You should inform pharmacy regarding this hospitalization. If it's within 23 hours, please make sure to inform pharmacy it's only 23 hours. But if it's more than 24 hours, then definitely that resident is out to the hospital and it will be discharged in our system as a discharge to hospital. Then remove all medications from your medication cart and place them in a secured medication room. For the purpose of security, bed hold medications shall be treated in the same fashion as the active medication supply. You're gonna remove your medication from your cart and put it in your medroom. It should be locked, okay? Medroom should always be locked and only nurses can go into that medroom. If this resident has those narcotics, please make sure to remove it from your cart, which is surveyor recommendation for med holds, and put it technically, it's considered that you need to destroy them because they went to the hospital, unless otherwise it's a 23-hour, then you can utilize those medications. But sometimes we always keep them and utilize it, but technically the right way of doing it is to destroy that medication after 24 hours being admitted to the hospital. So keep them in a secure bedroom, double locked. Then these medications shall be reviewed on a regular basis to remove, return, or proper dispose of those medications which will not be usable because of resident's death, drug recall, or expired medications. You can utilize it as soon as the resident comes back. Make sure to check with the new orders. If these orders are correct and directions are correct, you can utilize it. If directions are wrong, and still you can utilize it, put a direction change sticker to it, and still you can utilize those medications. And if they're not, upon the return from the hospital and all these medications you have checked, you have reutilized what you can, then the ones that you don't need, you can return it for destruction. Medications that can be reutilized shall be written as profile only. So pharmacy will not send it until once you refill it or once your cycle comes out. So whichever comes first. Medications that cannot be reutilized shall be returned to the pharmacy for credit or destruction, or shall be destroyed in the facility according to facility policy. There are certain medications that cannot be returned due to strict packaging, infection control, and storage guidelines. First of all, your narcotics. All of you know that narcotics cannot be returned per DEA ruling, and it needs to be destroyed in the facility no matter what. Secondly, inhalers. The only thing that you can return inhalers are unopened, the ones that in sealed aluminum foil. You can return those to the pharmacy, but the inhalers that were utilized, you cannot return due to infection control. Liquids, you cannot return it because anytime it can spill, and once it's spilled, hazardous to the driver or whoever is transporting those medications back to the pharmacy. Eye drops and ear drops, the same as inhaler. Once it's opened, you cannot return it to the pharmacy, infection control. Same thing with creams, ointments, topical solutions. Bulk items like Miralax or Metamucil, it's powder form. Once it's open, it can spill similar to liquid, and you don't want it to be returned to the pharmacy. Items not provided by United RX. There are medications that come in from family or other pharmacy. We can destroy these. That's fine. But the thing is, if this family wants to take all these medications, you can return it to them so they can destroy it on their own, or you can destroy it in the facility or whatever the preference is. Definitely compounds, prescription, and IV mixtures. If you use it, you cannot return it. The only thing that you can return is those vials that are pouched and it's not punctured, then you can return those. Special order items. These are items that are too expensive. We want to make sure that you really don't need those medications, if ever, because if you return it to the pharmacy and you want it back again, these are too expensive medications. Insulins, you cannot return it to the pharmacy due to infection control. Items that can be returned, invoice credits will be determined on a case-to-case basis. Unpunched bingo cards, which are non-narcotics. You can return it to the pharmacy. It can be credited on case-to-case basis. Unit dose package or punch card, you can return it, but it cannot be credited. That's why if you have like 3 bingo cards that the pharmacy send due to CID dosing, make sure to puncture it 1 bingo card at a time, because if you puncture 3 cards and you want to return it for credit, it cannot be credited. But if you just punctured 1 card and then return without puncturing those two cards and you want it to be credited, then that's the time we can credit it on a case-to-case basis. Half tabs, definitely, it cannot be credited, but it can be returned. Any expired medications can be returned, but not credited.
So FILMA talks about sending medications home with the resident, and there's an easy way to do that to save your team from having to handwrite what's going home. We're going to take a look at Framework Link, which is our online portal that allows you views into the pharmacy. So to get there, if you don't have a password, send me an email and I'll show that slide at the end. If you need a password reset, send me an email and we'll take care of that. If there are people on your team that are new and don't have passwords, etc., just send me a list of people that you want added. We do a full Framework Link training the first Monday of each month. That should be on the administrator or DON's calendar. So again, unitedrx.net, click on Framework Link in the top right corner, hit the enter button then in the bottom left corner, enter in your user ID, which is a 4-digit code and a password, click login, and you will see your facility's name on the top left and your name on the top right. The menu bar is at the top here. By clicking on resident maintenance, it pulls up exactly what you can find in here. And we're going to focus on the print discharge summary at the bottom. Once you click on print discharge summary, you'll see this screen where it gives you the option of a date, the person that you're going to discharge. In this case, we're choosing Peter Brady. This is our test facility, so these are all fictitious patients. Peter Brady, of course, being my favorite. Click on OK, and up will come this document that you can print out. So it is a discharge summary. It'll have the resident's name, their date of birth, their nurse's station, and what they are on in your facility. And it'll all be pre-populated. And again, since this is in our test facility, please ignore the directions if they're not ready, if they're not right, or the dispense quantity, et cetera, is not right. So what you see, though, is what your resident has on hand. And if they're going home with it, that generally means they're going to continue for use, but yes or no. When it was last filled, what was dispensed, and most importantly, what they're going home with. So, Flovent, maybe there's 15 puffs left. The paracalcitol caplet, maybe there's 2 left that they're going home with. Write down the next dose due. Then at the bottom, the responsible person will need to sign it and date it. And down here, right here, is a little note here that says, I understand and accept responsibility for this medication regimen and have taken possession of the applicable meds. Unless otherwise noted, I waive the child-resistant packaging option. So this is that child packaging option waiver, and the nurse signs it at the bottom, and the resident is good to go. FILMA touched on narcotics, and if those are not going home, those are, specifically narcotics controls 2 through 5 are things that cannot be returned to the pharmacy, the DEA regulation. I often talk with our customers, and we're as flexible as we need to be, and we'll make as many changes as we can to provide the best service we can to you, to the point of where something's illegal. This is that prime example. We just simply cannot. We'll take back, as FILMA described, we'll take back, even somebody else's medications, but narcotics are just something we can't do. You'll need to destroy them yourself. Using Framework Link, it becomes something that's very easily trackable. So if you go back to the main menu and click on drug orders, down at the bottom of that menu is controlled substance destruction. So up comes a menu, you click on that, and up comes this box where you type in or scan in the prescription number, click on look up order, and you'll see this screen. So in this case, Peter Brady dispensed some morphine. He's left the facility, didn't take the morphine with him, and now you've got 15 milliliters left of morphine that you don't want in your facility anymore. It's a hazard. You put in destroy quantity, what that is. So we'll just say 15, and at the bottom you're going to put in a disposition method, let's say kitty litter. So it's going to look like this. Click on add item down here at the bottom, and then you can continue to build that list. So if you've got 10 or 15 things that you need to destroy from 10 or 15 residents, you just keep building that list. When you're done, hit print log here on the top right, and up will come a record of disposal for controlled substances. So we'll have the prescription number, resident's name, the medication, dispense date, what you're destroying, date that you're destroying it, method. It's a way to avoid handwriting. You print this out, you have DON sign it and a witness sign it, date it, and now you can file it per facility protocol. This form will also stay within the framework link system, minus the signatures, of course. So you can go back and say this controlled substance destruction inquiry. So once again, thank you for attending.